We were told that the cost of living was rising and that we, the wicked BLP, was responsible for the cost of living. And the Democratic Labour Party based a campaign on 3 myths. And they sold it to you. And several of you here were taken in by their lies and deception. They told you that job number 1, 2, and 3 would be to lower the cost of living. They told you that families were first. And most importantly, they told you that they were going to bring transparency and good governance to this country. And remarkably, they were going to bring about they were going to achieve these 3 myths because they were bringing, and that is what they told you, not me, that they were bringing clean, caring, committed, and competent politicians. What a lie! What deception! 3 myths, and I will deal with them one by one. Families first was a myth. And you have not heard a word, or indeed the 2 words used together, since the demise of David Thompson. First myth, families no longer first, not even mentioned. Cost of living, rising daily. Food prices galloping, 30% increases since the last election. Inflation, fuel prices 70% higher. Don't let us speak about electricity and water and VAT. Everything that increases the cost of living. And there we're going to reduce it. What utter deception. And then you have an accidental prime minister. And that is what he is, an accidental prime minister. When the people of this country are crying out the cost of living, the suffering, a report showing increasing poverty, your central bank governor speaking about zero growth, and you have an accidental prime minister quoting Latin phrases, giving history lessons about the Democratic Labour Party. And when he is tired, quoting from the Bible. You understand why the time is up for Freundel? Do you understand that he is completely out of touch with your reality? And it is time for him to go? Don't you understand this? That was myth number 2. They spoke of transparency and good governance. Transparency. Do you understand? Throughout Barbados, in the villages, by the rum shops, in the supermarkets, wherever 2 or 3 are gathered, at this point in time, there is some conversation about some minister, and it is not good. Talk about transparency and good governance, and you have a minister of housing. And all of you know why he is referred to as Mr. 5 and 10. And if you don't know, ask the person next to you. A minister of the environment, transparency and good governance, and everyone refers to him as the check man, transparency and good governance, and the Minister of Public Works, my opponent, who is referred to as the Minister of Trans-Tech, and they have the temerity to tell you about transparency and good governance, but they think you are foolish. Do you understand what is happening in this country under the DLP? And none of those things that I spoke about have anything to do with any global economic problems. Those are homegrown problems and homegrown solutions. But they do not speak of transparency and good governance. But tonight is special. And when I speak of governance and transparency, we go to the depths when we discuss and speak about the Minister of Health. And this is important because in terms of health, I was attacked. I don't know how I survived. Everything was wrong. They had all the solutions to health care in this country. And 5 years later, what do they have to show? And you have a Minister of Health. And tonight, I'm going to speak about him. A Minister of Health who has responsibility for the Queen Elizabeth Hospital, for the Barbados Drug Service, and indeed the care of the elderly when he remembers that. And there are issues affecting all three of these categories, all three of these areas. And you have a Minister of Health who is in everything. Everything. He pushes his mouth in everything. Someone told me the other day he is like salt. The only difference is that at least salt is useful, while he is not. But clearly, the QH is in a mess. And I said so in October, and I repeat it tonight, that the QH is in a mess. And I say so without any apologies to anyone. And while the QH is in a mess, this Minister of Health, this gentleman, if I may call him that, is concerned about who is the father of whose children. Can you imagine? He cannot tell you when the touted St. John Polyclinic will open its doors to patients. But he can discuss who is the father of whose children. It was to be finished in October. It was to be finished in November. It is to be finished this month. Impossible. 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 He is obsessed with who is eating on a Tuesday in Parliament. He can go to the press this week and tell a deliberate lie, but that is his nature. He is worrying about who is eating. And they told me that he was in a Nation Better Health magazine and he looked like a whale in a tub. I didn't see it. I didn't see it. But he had on a bikini. I don't know. I said I didn't see it. He is concerned about burning, as he describes it as stuff. Any people out here from Bayfield in St. Philip, where the Minister of Health had his origins, or where he lived for a number of years, you're from there? Good. I would like the people from Bayfield to tell me, not from there, what do you feel about the minister saying that the burning of stuff should be outlawed? I would like to know how his former neighbors in Bayfield feel about that. I don't know why you're smiling. I never said what he burned. He said stuff. He is concerned about the need for a breathalyzer to be introduced almost immediately. And the QH is in a mess. And he is concerned about the breathalyzer. But I don't understand. I don't understand. The Prime Minister said recently that we in the BLP, he has never seen a pig so happy to go to see Saturday to be slaughtered. With the Minister of Health speaking and asking for a breathalyzer test. Can you imagine? How would he get home on Thursdays and Friday nights from the Bush Bar? Or would you, the taxpayers, you and me, be now asked to foot the bill for a driver to get him home? And all of these things he is involved in. and major problems at the Queen Elizabeth Hospital. Crying out, needing to be dealt with. And to cut it all, we can see pictures of the minister dancing in the new year. Someone said he looked like a Tobago gal. I don't know what that means. I don't know. But in the QEH, a myriad of problems in terms of human HR, under his watch, under his stewardship. And I'm talking about governance and transparency. 2 CEOs, 3 boards, 3 board chairmen, total chaos. Up to tonight, 3 senior management posts still unfilled. Consultants up in arms have court cases against the board. BAM always in the news with the board or with the minister about contracts, about salaries, about allowances. The nurses criticized over and over by the minister. I said in October there were 66 vacancies for nurses. Between the end of September and the end of December, 67 nurses resigned from the QEH. Not retired, resigned. So you could well have more than 100 vacancies for nurses in the Queen Elizabeth Hospital. Does this not impact on the health care that is delivered in that institution? Does not possibly impact on each and every one of you? And these are caring people, concerned, wanting to build a society. Where's the compassion? Where's the concern? And we get to the area of clinical care. Clinical care. Problems. Before we go there, the new hospital, the minister was out of the blocks and told all of Barbados, more than a year ago, that a new hospital is to be constructed at Kingsland. Do you know that the committee that is looking at the location for possibly for a new hospital has not made a decision as yet? Example of the transparency and the good governance. Can you really trust him? I'm not going to say that. Sterilization within the hospital, vitally important. The sterilization department in chaos. 2 of the autoclaves out of order for months. Dialysis unit. Dialysis. You need to know these things in order to cut costs. They ordered the cheapest salt available to be used in the water treatment for dialysis. Let them tell you. Let them tell you how many infections occurred in the month of July and August 2012 within the dialysis department among the patients. Further, let them tell you how many people died, dialysis patients. Let them tell you that. And this is a caring government that is concerned, caring. The EU provided 6 million euros for the establishment of a cardiac unit at the QEH in 2006. This is now 2013. Nothing has happened. When we admitted office, plans were in progress in terms of design. Nothing has happened in terms of cardiac care. Yet you can hear the minister speaking about concerns about obesity and the chronic diseases. But when you hear him and you look at him, do you understand how concerned he is? You understand how concerned he is? But I get very serious when we get to issues of life and death. And it might be unpalatable to several of you, but that is the sad reality and a reflection of what is occurring in this country in terms of health care under the stewardship of Donald Innes, and indeed, by extension, Freundel Stewart and the DLP. The level of incompetence. When back in May, and I spoke about it then, that there could possibly have been a death of an infant because of the lack of a pediatric ventilator, which the consultant pediatricians had been asking for over 18 months at a cost of approximately $10,000. And I was told nobody knows anything about that. I have to move on. No one knows about that. But at the same time, the QEH, the board of the Queen Elizabeth Hospital, could provide $45,000 for someone to be brought back to Barbados by air ambulance who happens to have the surname of a board member. That is the sort of stuff we are dealing with at the QEH. And I could go on, and there will be time, there will be opportunities within this campaign to speak about that, to speak about procurement and the issues that Comrade William Duguid spoke about. But I need to spend a few minutes on the drug service and the draconian changes that were implemented by Donald Innes and the wicked DLP. Draconian changes. And he boasts about $12 million in savings. And I ask, at what cost in terms of death and morbidity? I ask that question, where a whole hundreds of drugs were removed from the formulary. Combination therapy that elderly people in this country had been using for years to control their diabetes and hypertension, and you call yourself caring and committed about building a society? And these people were removed from this medication. If they want it, they'll have to pay for it. Elderly, retired people, by and large. Those who couldn't afford, doctors then had to fiddle. Where they were getting one tablet, they now had to be getting 2 and 3. And try to get their hypertension and their diabetes control. Do you know that people had to have died as a result of that? You know that. Indeed, in terms of their hypertension and the levels of strokes that would have occurred. But it gets worse than that. There's a class of Barbadians, of people, non-nationals, thousands of them, who have been living in this country for decades, paid taxes, worked, married, voted in this country. And they were removed. I know of one case, a lady who came here from St. Lucia. She lived in Barbados for 42 years. I said lived. Worked in the cane field. Had children from a Barbadian. In later years became a domestic. Had medical problems. Was maintained on warfarin and other drugs. Was maintained. A domestic, $250 a week. Renting, has to buy food, has to get clothing, has to pay for utilities. And then in April 2011, the minister issues an edict that from henceforth she will have to pay for her medication. She had to make serious decisions. In 3 months, she was dead. This is not the kind of society we should be having in Barbados. This should not be occurring in this country in 2013. Nowhere. And you know what? The Prime Minister, in his only press conference in April 2011, in response to a question about that, said it was wrong and it should not happen. And in 2 years later, nothing has been done. Now this is one of the reasons. If none, how many more persons have died in that situation? How many more must die? And you have a prime minister, an accidental prime minister, stating that this is wrong, it should not happen, and 2 years later, nothing has happened. You understand why we are saying that the time is up? Do you understand why we in the Barbados Labour Party have stated repeatedly this week that the time is up? Enough is enough. It is time for us to rid ourselves of the DLP. The time is up. The time is up for Freundel and the DLP. The time is up for the DLP and its lies. The time is up for the DLP and its deception. Ladies and gentlemen, the time is up and it is time for them to go. We in the DLP have a better way, and we will reveal this to you in due course. Good night and God bless.
All of you people out there who keep sending me notes and messages and telling me who to attack and who to curse and abuse, stop it. I am not in